Well, we will go ahead and start. Hello, everyone, and welcome to Faith-Based Birthing. And today I am so excited to be doing a meet and greet with Dr.
Angela. Dr. Angela Turnow.
Okay. Do you go by Angela or Angie, or does it matter? Like, what do we call you?
Yeah, Angela, or my sisters call me Ange. Some people call me Angie, like two people. So usually Angela.
Okay. Awesome. And she is a therapist, pelvic floor therapist. And guys, if you don't know about pelvic floor therapy, if you've never heard of it, if this is a completely new term to you, number one, I'm sorry. Number two, this is something that our providers should be talking to us about, and there should be more education around this. Number three, learning from someone who knows how to handle your body through this pregnancy and birth journey matters so much. And so I'm so excited that she's here and that she's going to be a contributor for us. And so today we're just going to get to know her a little bit, and you're going to find out why you need her, or people like her in your area, whatever. But she does have some virtual stuff available. So if that's, if you want to go that route, that would be awesome. But anyway, so tell us a little bit about you.
So I live in northern Minnesota, in Park Rapids. We have two kids. We have a 3-year-old and a 1-year-old. So life is very busy. We have a lake lot, which is awesome. Love just like being outside and lake life. I started being a pelvic floor PT after the birth of my first, so about 3 years ago. But before that, I was an orthopedic PT. So I know like how the body connects together, and then just like that missing piece of the pelvic floor, which I think in school we got one day on, like in a 3-year curriculum doctorate program, we got one day. I think I was even sick that day. So I really didn't have any of it, like besides the PowerPoint situation. I became a pelvic floor PT because I just didn't have the birth that I wanted. It went fine. I was healthy. Abram was healthy. But after, like, I'm a pretty active person. Like, I love doing triathlons. I've done a marathon. I ran in college. And I went back to my normal, what I knew to be normal, like workout stuff, taking it easy, because that was the advice I was given, was just to like, take it easy. But it wasn't working. Like the things, like I was doing all the things that I knew to be what I should be doing as a PT, but it wasn't like I was still peeing my pants, and it just wasn't like I was having chronic SI joint pain. And it wasn't until I went to my first course, which they're pretty intensive courses. They're 3-day. I've been to a couple courses now, and then I've been to a 13-week course. And then I've been doing it for, 3 years, but it wasn't until I went to my first course and we learned internal work and we practiced on each other, and that reproduced my left SI joint pain and calmed it all down. I had painful sex, like calmed that down. And, as far as the painful sex piece, I was told just that was normal. It would go away, and it just didn't. And, they're muscles. And so muscles are muscles, and they should be addressed specifically, just like if you had a knee surgery or a shoulder surgery, or, not even a surgery, but just like an injury, you would rehab that specifically. And so I'm pretty passionate about it now, because I didn't have that information. And, a lot of my friends, I created my Achieve Movement Facebook and Instagram and business because I want my friends and family and just like anybody to have the same access to information. I live in a small town, so I am the only PT or pelvic floor PT in like an hour radius. And I know that that's kind of normal, if you're in an area that you have pelvic floor PT available to you, that's awesome. But even if you do, there's all these other barriers, like trying to find childcare, or, trying to schedule around naps and feedings, and like, just get there, or you have extra kids, and you're trying to juggle it all. And so I get all those barriers. And so, if nothing else, like my courses and my online resources are available just so you have access to information. And then beyond that, if you need specific hands-on work, I try to tell people when that might be appropriate. So.
Awesome. Well, so I didn't know my first two pregnancies. I didn't know anything about pelvic floor. Nobody had said anything to me. And I had a baby. My first baby was over 10 pounds. And so there was no discussion whatsoever about this. And then someone that I was
talking to, such a big baby.
So someone that I was talking to, literally, I'm sitting there talking to this person, and she goes, "I have to go to the bathroom." And I was like, "Okay, thanks for telling me." And she was like, "My bladder just fell out. I have to go to the bathroom." And I was like, "I'm sorry, you're what?" So I'm going, "Why do bladders fall out?" And I stumble on prolapse. And I'm like, why have I never been told as a young mom, well, I'm not so young, but as a new mom and as a learning mom, like, why have I never been told about this whole pelvic floor industry and that I need to know about it? And then with my second, I didn't know what diastasis recti was. So then I'm like, oh, maybe this is what's going on. Still, no one is pointing me to a pelvic floor therapist and telling me that there's hope for that. Oh yeah, there's exercises that you can go and do for that. But no one's telling me about people like you and that I need you. And so then with my third, I had done a whole lot more research and and just grew in that whole area. So if women are listening like me and they've never been told about this whole pelvic floor thing, when should we, as pregnant women and birthing women, try to encounter, seek out, find, learn about a pelvic floor therapist? At what point?
Well, any point, I would say. That would be any point. So one, if you are pregnant, still there? Okay, sorry. Yes. My husband was calling me. I had to decline that. So if you're pregnant and you're having pain, whether it's hip pain, a side point pain, pubic symphysis pain, like that can all be pelvic floor related. So that's a great time to get pelvic floor PT or seek out help for that, because pain in pregnancy might be common, but it's not normal. And there is help for that. Number two, like labor prep. So when I have a pretty good working relationship now with our midwife team. And so if anybody says any pain, like if they say pain at all, I'm like, send them to me. But even then, I think that what pregnant lady doesn't have pain? So I think anybody should just go see a pelvic floor PT when you're pregnant, because that can help prep your pelvic floor for childbirth. So, when I'm talking to them about childbirth, I'm saying things like, okay, your pelvic floor, we need that to lengthen to allow baby out. So, versus like pushing your baby out. And I know you go into a whole bunch of stuff on that. But we want our pelvic floor to lengthen to allow baby out. So when our uterus contracts, we have the space with our pelvic floor. So a lot of times when we're pregnant, there's all this extra weight and pressure, and our pelvic floor can actually become tense. And so working on lengthening your pelvic floor during pregnancy is super helpful. And I teach people how to do that. I am actually going to be, before you called, I was going to be shooting some videos on a pain-free pregnancy, like a 21-day challenge thing. My sister's pregnant, so I mostly want to do it for her so she knows all the information. So there's that. And then when you're postpartum, pregnancy or childbirth is like a massive strain and sprain on your vagina. Like you just sprained your vagina, basically. Your pelvic floor muscles lengthen, or they stretch 350%. Like that's, if you have ever strained your hamstring or had a terrible ankle sprain, like you would get therapy after that to relearn how to use those muscles. And so the pelvic floor is no different. And so, it's a good time to relearn how to use these muscles when you're early postpartum. But if you're beyond that, that's okay, because you can still, there's still hope for like relearning how to use those muscles. So at any point, if you're 10 years postpartum, that's great. We can still work with you there. So does that answer your question?
Yes. Yes. And that's what, so, when I first found out about therapy, my first question was, oh, okay. So this is like a whole after, this is a postpartum thing that I'll need to straighten up whatever is messed up in the process.
Yeah.
But as I studied and learned and talked to more, people like you, just learning the process of, oh no, this is where we need to encounter and understand what our bodies need. So, we get pregnant and that's great. And, that's one of my soapboxes too, is how to care for ourselves actually during pregnancy. And then it matters for the birth experience and all that. But, and then in the postpartum, our society just doesn't allow us, I guess, to take care of ourselves the way that we should, especially, I'm an entrepreneur. I own several businesses, and so taking a day off, making yourself take a day off is difficult. And so we just don't have that mindset in our society anymore. And so
I think even if you know what you know, like, even though I know, it is still hard. Like, it is still hard to sit your butt down, like sit down. You just basically had a car crash. If you had a car accident, like, you would have no problem, and society and your, loved ones would have no problem just letting you sit with your feet up, but because the injury is not seen, it's,
right,
forgotten. So, I mean, within the first week or two, like, yeah, everybody, understands, but it takes time. Like, it takes time, and you need to allow your body that time.
Yes, absolutely. Absolutely. So, and I know that, Emily Smith had a question, which was how far postpartum, right? Can you do this? And about diastasis recti. So can you, talk on that just a second? And her question is, I think I have it. Do hormones affect it? And how far, am I too far postpartum? I think she's just maybe like 15 months or something, but am I too far postpartum to fix it?
Let's start with the last question. You're not too far postpartum. You're never too far. Hormones do affect it. If you're still nursing, you still have relaxin in your body. And so it's more difficult to heal a diastasis, because your joints are still, or your ligaments are still kind of like loosey-goosey kind of. So you can still rehab it and still work on it, but it is more challenging. So to be honest, I'm still nursing and I'm working on it, but I still have a diastasis, and my little one's 15 months too. So, but you can still work on it. And so, meaning you can make it better, and there's things that you can do to help it not get worse. Okay. Because it can get worse. And so let's just first talk about maybe what a diastasis even is. So a diastasis is an abdominal separation. So, I have a balloon here that I use. It's a little deflated. It was my son's. He was playing with it. So it's a little sad balloon. But so every pregnant lady will have a diastasis. If for good reason, like, it's protective. So you want your body to expand in all the different areas when you're carrying a baby. And then even early postpartum, it's still protective, which let's talk about that in a minute. But so your core, I talk about the core as a balloon. And so just like a balloon, one part of your core impacts the other. Now, as far as your core, the top of your core is your breathing. That's your respiratory diaphragm. And then the bottom of your core is your pelvic floor. And then the surrounding sides are your deep abdominals. And so, just like a balloon, if like one part is tight, so like, let's say you have a tight pelvic floor, I don't know if you can see, but it would balloon out, right? Or let's say, so anyways, they all impact each other, right? If one part's tight, or if one part's not like coordinating together, it would impact the whole core. And so abdominal separation, a tense or tight pelvic floor can impact that. So that would be one thing. So that would be like how the pelvic floor could impact a diastasis or abdominal separation. And then early postpartum, a diastasis is actually protective because, we want our body to expand everywhere. And if you just quit it, like if you're thinking that you have to fix your diastasis, if that's the first thing you have to fix, well, you could cinch your abs together, and then that puts a lot of pressure down on your pelvic floor. And so that could actually contribute to prolapse or something like that, or bladder leaks. So I'm not a huge fan of those like abdominal binders or belly trainers or waist trainers, whatever they're called, for that reason, because if you're trying to cinch something together, that actually puts a lot of pressure down, just like if you kind of squeeze the middle of a balloon. Also, it doesn't teach you how to reuse those muscles. All you're doing is just putting pressure on them. So instead, I like to teach people how to tape their abdominal separation. That's a kinder way of doing that. And if you are going to use an abdominal binder, only use it as much tension as you need for only as like little amount of time as you need it. So they have their place. But I go into that in my 4th trimester course deeper. I also, in my 4th trimester course, teach you how to check your own diastasis. So there's 2 factors. So there's like distance, so like how far apart, and then depth. And so how like far in your finger can go. And so depth matters more than distance. So I think a lot of people get hooked up on it's 3 fingers or it's 4 fingers. And, I mean, it matters, but it doesn't matter. The bigger difference is how deep it is. Because if it's super squishy, like if you can put, certainly when you're early postpartum, like day 1, like you might be able to put your whole finger in there. You just had a baby, right? Like that's okay. That's normal. That's good. Like that should happen. And so, yeah, I never teach people how to like work on their abs first. You want to work on the breathing and then the pelvic floor. And then, during all of that, you are actually working on your deep abdominals, but then, more specifically, like after you've mastered the first 2 things, then I'll teach you how to do some ab stuff. But the pelvic floor has to be engaged. You have to know what you're doing with that. Because if you don't, you could just be tensing and putting pressure down and you wouldn't really know it because you're not in tune with that.
Yeah, that's awesome. Thank you so much for that information. And ladies, here's what we'll do. Do you want me to call you Dr. Angela? Just Angela? What do you?
just Angela. I mean, if people don't trust me, then I say, you can call me Dr. Angela, but otherwise you call me Angela.
So Angela is going to be on with us several times. We're going to be doing Q&A sessions with her. And so you guys are going to get to know her a little bit more. And so if you have specific questions about pelvic floor, about what you need, why you need it still, just different things. And there's so much information just in pregnancy and birth in general that we don't address and that our providers don't address, whether that is a fantastic OB or a fantastic midwife. Like some things are just not
they're not the muscle people, right? Like it's not even their fault. They just don't know it. So, I think it's a waste of energy to be upset with them,
right?
Because they just don't know. Right. And so going to somebody that is the expert is a good idea.
Yeah. Yeah. And so, it goes right back to the whole, like, you are your best advocate, educate yourself, research, learn some things, and ask questions. And so if you have any questions about pelvic floor stuff, send them in and we'll be live with her in the group, and she'll be able to interact with you guys some and, different things like that. And so post your questions below or message them to me, whatever, you want to do. And we'll get your questions answered too. And I'm so excited that you're here, Angela, and I'm excited that you're going to be contributing to the group, and I love it. And so is there any like last thing that you want to say, hey, consider this, look at this, know this as a pregnant woman or postpartum, in that, like, what matters? What, if you could say there's one thing that matters so much, what is it?
This is going to seem a little bit like off kilter, but I think meditating is actually important. So that's because it helps your body calm down. So a lot of times in our society and like, just there's so much like stress revolved around and anxiety revolved around pregnancy. Am I doing the right thing? Or, and childbirth and even postpartum, that you're just amped up. So learning how to calm down, because we can carry our pelvic floor. So I have my model here. I'm just going to pull it out. So this is your pelvis and then your pelvic floor. Pubic bone in the front, sit bones on the bottom here, and then tailbone in the back. So just so you can see it there. But just like people can carry tension in their jaw, clenching, or your shoulders kind of tensing, same thing happens with your pelvic floor. And so your pelvic floor is like your guard dog. It's protective of you. And so we don't always know that we're tense there until, like I know, because I will have flare-ups. Like if I'm traveling and I'm stressed, and then I might have more symptoms. And so I have to like work to calm, and using that breathing, just like I said, the breathing is the top portion of the pelvic floor, or the top part of the core, excuse me. And so, in pregnancy and childbirth and early postpartum, doing some deep breathing just to calm your body down can be really restorative to the pelvic floor, even if you have no idea what you're doing. So,
right. It matters. Just in mom, like one of the talks that I do is called Defensive Motherhood. And I'm old. I've been traveling and speaking for a lot of years. And so, I mean, it just like, we all need those deep breath moments. We need that relax, just like, so I saw a post the other day that said, I don't know who needs this, but unclench your jaws. Like, and I'm like, oh yeah, okay, I have that. But it matters that we just take that deep breath for a moment, even if it's just to sit down, calm down, read some scripts. That's my go-to, is reading some scripture, whatever that looks like. So, and our body is so amazingly designed to all work together. Like, it blows my mind. And so we need to think about all the parts,
mm-hmm. Think to breathe into your pelvis. That's what I tell my mom. Breathe into your pelvis. Breathe into your pelvis. Even if you have no idea what that should feel like or look like just try it and be bad at it. And that's okay.
Awesome.
You got to start somewhere. So,
well, I'm looking so forward to more chats with you, and I'm looking forward to these women getting to know you in the group. And I will jump off here and let you go record your awesome videos. I'm so excited about that. And I will talk to you later. Again, ladies, if you have any questions, post them below or send them in message. And everybody say hi to Dr. Angela, and we'll talk to you later.
Okay, bye.
Bye.